Well, the most common thing I as an interventional cardiologist deal with is coronary syndromes or heart attacks. It's a common thing that you have to develop a system and a skill set to deliver uncommonly well. And that's our main goal. We do hundreds and hundreds of heart attacks a year, and it becomes important to make the system work, not just a procedure work. And so that's one of the most interesting things to me, is making certain that the system that delivers this care, which really involves a variety of different kinds of doctors and hospital scenarios, works as smoothly as possible. Heart attacks is a very broad kind of topic. It doesn't really mean anything to an interventional cardiologist because there's so many different kinds of presentations, but the most common is probably something called a STEMI, which is an acute heart attack, where a blood clot is occluding an artery or closing off the blood flow to that heart muscle. And that is the kind of situation that a systems-based approach really makes a big difference, because the quicker you deal with it, the more quickly the patient's heart muscles receiving better blood flow, and the better they do in the short term and long term. And so that's the most common thing that we deal with as interventional cardiologists. nonSTEMI, which is not 100% or acute occlusion of a blood vessel with a blood clot, but more chronic, combined with that kind of more acute problem that we deal with up front with medicines, and then the next day, commonly, or later in the day, that's when we can attempt to use coronary interventional tools. The third most common thing is more chronic ischemia, we call it. And those are people who have windedness very commonly, or angina, or exertional chest pain, or any kind of exertional intolerance that is caused by more chronic blockages. And those people do well with medicines commonly, but when medication isn't enough to make them feel better and be able to take care of their day-to-day activities, then incrementally you can benefit them by using any kind of revascularization technique. And that means stents or surgeries or other angioplasty techniques.